The old-fashioned model of everyone just having one clinician, one patient in one room being seen simply can't cope with the level of need and demand that's out there.
Dr. Tim Norbury loves going to work. He's making changes to his GP practice that seems to be making a difference. Staff and patients agree.
We deal with everything on the day.
No, I've got no complaints at all.
The doctors are not really in charge anymore in the same way.
The consultation just takes as long as it needs.
I absolutely love it.
OK, you've been having some tests to do with your circulation.
Tucked alongside the M5 is Taunton Vale Surgery's clinical hub.
But it is controlling your blood pressure very well.
GPs, a paramedic and a nurse practitioner
There'll also be some messages.
are working their way through the list of patients, deciding who needs a call or a face-to-face appointment. It's 5 p.m. on a Tuesday afternoon.
So we're over 300 now. From a list like that of 300, we'd typically find somewhere between 20 and 30 will have needed to come for a face-to-face appointment. When patients contact their surgery, they're often thinking, I need to see a doctor. But they don't really mean that. What they actually mean is I've got a healthcare need or a healthcare problem and I really want someone to help me with that.
So all the ones crossed out are ones that have already been dealt with.
And they do that here. Around 10 patient service advisors receive calls, emails, photos and texts from patients all day. There's no bottleneck for appointments here.
We've all been there at 8 o'clock in the morning, desperately trying to get through to the surgery, constantly pressing redial on our phones. Here, there's no need. And patients know when they ring the surgery, it might not be a doctor that they get to see or speak to.
I think GPs are amazing. We've got a lot to offer. But there are other members of our team who can do things as well as or better than we can.
It's that flexibility that has kept Dr. Lisa Horman working in the NHS after she was on the verge of leaving.
Yeah, it's certainly close to being burnt out.
She's carved out a new full-time role split between seeing patients in the community and in the hub.
I'm really enjoying it at the moment. I think the most exciting thing is looking to create a legacy. We've now got GP trainees coming to work with us who are coming to the homeless clinics with me, they're coming to the care homes. And so things that I've learnt right at the end of my career, they're going to be starting off with.
How often have you been feeling like you wanted to take your life?
When we were filming back in the hub, Caroline Sims took a call from a 14-year-old girl. The girl was being bullied at school. Caroline was able to refer her directly to a mental health team who are now contacting her daily.
I do about 10, 15 mental health calls a day, and out of them, there might be 2 or 3 that want to take their own life. We don't have an algorithm that we follow. This is all from our training and our knowledge. And if we're not sure, we just give it back to the GP. So I can do a full consultation, speak to the GP and say, look, this is what I think it is. I'm not 100% sure of my consultation. Will you take over, please? And they will.
We'll sort the night for you and we'll text it to you when it's ready.
The office manager says despite having over 3,000 people on their books, patients on the whole seem more understanding.
They've got more confidence in the system and they're actually nicer to the staff that they're speaking to in the first instance because they're not demanding face-to-face appointments. You come into medicine to make a difference to people. And I'm probably doing that more now than I ever have done.
We can admit them quicker, we can get an ambulance quicker, we can get the antibiotics to them quicker. It'll work. If only people give it a chance, it will work. I love it, absolutely love it.
There's still room to improve, and it's not cheaper to run. But all in all, this particular approach seems to be working for these patients and staff in this practice. Lucy Watkinson, BBC News, Taunton.